My name is Henry Vernov. I'm currently a product manager for healthcare vertical at Citrix.
My name is Craig Richardville. I'm the Chief Digital and Information Officer at Intermountain Health.
Craig, would you be able to share some of the examples how your organization have been able to leverage AI and maybe some of the outcomes that came out of it?
Yeah, great question. There's a few things out there. So one has been out there for a little bit, and it started for a few years, but it has matured quickly with the new large language models, and that's with our ambient intelligence, which is primarily for our physicians and our advanced care or advanced practice practitioners. So what that does is that interprets the conversation between the patient and the provider, and it creates a medical note with appropriate billing codes as part of that. It happens in a matter of seconds. When the visit is done, the provider can look at it, they can adjust it as appropriate, and then be done with the documentation for that visit. That's all done in the past. It has to have to be, dictated and transcribed, or somebody use the EMR as efficiently as possible to document the visit. And then you started seeing, initially you had the human interface, a lot of that work. So you had turnarounds up to 4 hours, which in some cases, you have to kind of recall what the conversation was. But now with the new technology, it's a matter of seconds. And we actually will be rolling that out to all of our providers, give them the option to use that tool here starting in April. So very soon we'll be sharing that all the way throughout. But we piloted with a couple hundred physicians and got some great feedback. And as that product matured, now it's ready for full system implementation. And next one is one that was inbox messaging, so that when patients or their family members send notes to the physicians, some of those are handled by the office, some of them are handled by the physician. But there's kind of emails, inbox messages that come through that somebody has to respond to. And typically, you're looking at something that, within 24 hours, that there's a response that comes back into that patient. What it does now is it interprets the message coming in. It understands what is in the medical record for that patient. It turns around, it creates a draft so that now the physician or his or her assistant now gets a draft, kind of a head start of what needs to be done. And it just has to edit it or review it. And then if it gets to the point where they want to shoot forward, then they're ready to reply back. So that it's a lot more efficient. There certainly is a lot more accurate, saves a lot of time, and also puts into things a little more empathetic. So it really just, not only does it reply, but it replies in a way that you'd want to be receiving that. So for example, it may go ahead and put in there, hope you're having a great day, or good morning, hope your family's well, whatever those different phrases might be. It gives you those options to be able to present yourself back to that patient or that member. And then I'll give you the third one, which is one that we're kind of co-developing, or at least investigating right now, is more on the virtual nursing side. And what that is, that really is, trying to look at a system that will survey the patient room, for example, be able to see if somebody's close to a fall, be able to see that the hand washing took place, all the different pieces that somebody would want to view or that a nurse would have. But also when you want to place an order or ask a question or bring in another provider, maybe you need a pharmacist to be able to verbalize that and have somebody come in virtually over on the patient TV and be able to have that other caregiver there with you as you're standing there talking or serving the patient. So all those types of pieces will help us to go back to kind of the 3 E's at the beginning, to be more efficient, to be more effective, and to have a better experience.